Hi, my name is Jordana Guillén and I'm studying medicine at Catholic University. My subject is medical English and the topic I'm going to talk about is emphysematous cystitis. Definition: Emphysematous cystitis is a rare entity characterized by pockets of gas in and around the bladder wall produced by bacterial or fungal fermentation. The presentation may be atypical and contrary to the degree of inflammation, patients may present with subtle clinical findings. Patients may complain of irritative symptoms, abdominal discomfort, or pneumaturia.
Cystitis is a condition which results in constant urge to urinate and a burning sensation during urination. There is also pain in the lower abdomen and back. The urine passed by the patient is thick, dark in color and has a pungent smell. Sometimes, the patient may pass blood or pus in the urine. Any infection in the urinary tract can lead to cystitis. Going for long stretches of time without urination leads to irritation in the bladder and can also cause this condition. Severe constipation, kidney or bladder stones, or enlargement of the prostate gland may also result in cystitis. Let us have a look at some home remedies which can provide relief in this condition. Boil a few drumsticks in water for 10 minutes. Strain the water, remove the drumsticks and peel its skin off. Crush it to make a paste. Place this paste on a sieve. Extract its juice. Consume this juice once daily and you will see an improvement in your condition. Take 1 cup of cucumber paste. Place it on a sieve. Extract its juice. Add 1 teaspoon of honey. Add 2 spoons of lemon juice. Mix it well. Drink this thrice a day.
Application in medicine. A 72-year-old woman with poorly controlled hyperlipidemia and diabetes present to the emergency department with a 5-day history of lower abdominal pain. She also had fever and reported nausea and vomiting. Physical examination revealed lower abdominal tenderness. Blood tests revealed leukocytosis associated with a left shift and elevation of the levels of C-reactive protein and glucose. A plain radiography of kidneys, ureters, and bladder showed air surrounding the bladder. An abdominal computed tomographic scan revealed an area of gas dissecting the bladder wall, bilateral hydronephrosis, and intramural gas with a cobblestone or beaded necklace appearance. Findings consistent with emphysematous cystitis. Pros and cons. Pros. The radiographic findings provide the first and only diagnostic clue. Abdominal pelvic CT can further delineate the extent of disease. Cons. Emphysematous cystitis requires aggressive treatment with parenteral antibiotics and bladder drainage. Delayed diagnosis may lead to unfavorable outcomes, including overwhelming infection, extension to ureters and renal parenchyma, bladder rupture, and death.
This is an ultrasound study of a urinary bladder of a male, and with full bladder, this is the maximum he could have folded. And what you see is that the anterior wall appears to be thick, as are the other walls. Now the magnified and measured the anterior wall. This is the anterior wall of the urinary bladder of a filled urinary bladder, full, measures 6 mm. So this wall is thick, anterior wall is thick. Now see that there are hypertrophic trabeculae seen, these ones, along the lateral wall of the urinary bladder, right lateral wall as well as the left lateral wall. These are all hypertrophic trabeculae, thick anterior wall, and as well as thick posterior wall. This posterior wall is also thick. These are the seminal vesicles. Seminal vesicles are normal. Now this is the definition of what we say as a case of bulbous cystitis. Thank you very much.
Issues applying Ecuador. Emphysematous cystitis is a urinary tract infection that is associated with gas formation and is commonly caused by Escherichia coli and Klebsiella pneumoniae. The disease is often associated with female sex, immunocompromised state, diabetes mellitus, previous recurrent urinary tract infections, urinary stasis, neurogenic bladder, and in transplant recipients. Conclusion: the patient was treated with broad-spectrum antimicrobial agents and placement of a Foley catheter. Subsequently, a urinary culture was positive for Escherichia coli. The patient was treated with antibiotics and recovered uneventfully.
E. coli are a large and diverse group of bacteria. Although most strains of E. coli are harmless, others can make people sick. Some kinds of E. coli can cause diarrhea, while others cause urinary tract infections, respiratory illness and pneumonia, and other illnesses. Still, other kinds of E. coli are used as markers for water contamination. Some kinds of E. coli cause disease by making a toxin called Shiga toxin. The bacteria that make these toxins are called Shiga toxin-producing E. coli, or STEC for short. The most commonly identified of these in North America is E. coli 0157H7. When you hear news reports about outbreaks of E. coli infections, they are usually talking about E. coli 0157. In addition to E. coli 0157, many other kinds can cause disease. People of any age can become infected. Very young children and the elderly are more likely to develop severe illness than others, but even healthy older children and young adults can become seriously ill. The symptoms of these infections vary for each person, but often include severe stomach cramps, diarrhea, and vomiting. If there is fever, it is usually not very high. Most people get better within 5 to 7 days. Some infections are very mild, but others are severe or even life-threatening. E. coli live in the guts of some animals, including cattle, goats, sheep, deer, and elk. The major source for human illness is cattle. Infections typically start when someone consumes contaminated food, unpasteurized raw milk products, or drinks contaminated water. Contact with cattle or contact with the feces of infected people can also cause infection. Some foods are considered to carry such a high risk of infection from E. coli 0157 or other harmful pathogens that health officials recommend that people avoid them completely. There are believed to be about 70,000 infections from E. coli 0157 each year in the United States alone. To learn more about E. coli or other food pathogens,
Thanks for your attention.